Provoking dialogue awaits us. And for those of you who this is your first time, don't worry if you don't know how an unconference goes. We have several expert facilitators who are going to walk us through the game plan of how today's grid will get populated. So that'll happen shortly. But first I want to go over some housekeeping logistics. If you're trying to get online, what you want to do is go to your Wi-Fi settings and look for Kaiser Guest. And there are outlets along there and there, and other spots, and in the rooms there's plenty of outlets. The hashtag today is HCSFBay on Twitter, so please use that. There are bathrooms over there, and another set of bathrooms in the entryway where you entered the building. This is a big, kind of confusing place if you haven't been here before. So there was a map on your chair, and there's some more maps posted around, and you'll see people wearing this very fashionable bright green t-shirt. You can see us. We are here to guide you in case you get lost and can't find your room. Lunch will be here at noon, set up behind there, and the reception will be, and the wine and beer will be here as well at 3 o'clock. So I think those are all my logistics. Without further ado, let's get started. I have the honor of introducing to you Dr. Jack Cochran. He is the Executive Director of the Permanente Federation, which represents the 15,000 physicians at Kaiser Permanente. And it's really fitting that we have Jack here today because he was an early champion of seeing technology as a valuable tool for physicians. And he is implementing many of the innovations that are transforming how we care for our patients. So I give you Jack Cochran.
Thanks. Thank you. I just want to check, did you say the beer and wine was here at 3 o'clock? This is a Hemi unconference. This isn't a full unconference. 3 o'clock, I guess. I'll be back. So while the nation is sort of toiling with can we get electronic records into healthcare, I have to tell you, because of some visionary leaders that I worked with, I've been paperless since 1997. Remember that? That was the 20th century. So this is not a theoretical capability, but we need a Gutenberg moment. You know what that is? You know, several hundred years ago, the monks had the tablets, right? And if you wanted to learn about the Bible, you went to the monks, and they had calligraphy, all the tablets and the biblical literature and all that, and you had to go to them. And then what happened? We democratized religion. We started to create movable print, and we translated all the great works into multiple languages. But doctors, the monks didn't lose their jobs. Their jobs just changed. They became more in the center of communication and interpretation and teaching. So our jobs are changing, but we're not gonna go away, so don't worry about that. We still need healers. We still need people who can augment the relationships. How do you find everyone in a room like this? I guess you just get dizzy. So that's what we need. You know, we've been living for decades or hundreds of years in the tyranny of the appointment, which means the only way you can get information is to go to the doctor. Take time out of your busy day, 4 hours. You know, our appointments, we think they're 15 minutes. For patients, they're 4 hours. Leave work, go in, park your car, get in our waiting room, read a 3-year-old People magazine, you know? Patients come to see us, they think Brad Pitt is still with Jennifer Aniston because they're reading those Our People magazines. And then you go in and you see the doctor and you get the richness of that relationship. So that's how we've done it in the past, and it's 4 hours out of the patient's day. You know, every year I'm fortunate enough I get to make a trip with a team that I've been part of for 25 years. We go to East Africa, and we do teaching, we do surgery. And a few years ago in Arusha, in Tanzania, these machines started appearing called ATM machines. This is the developing world, right? So I would go in and I'd put in my ATM and it would say, Jack Cochran, would you like that money in euros, shillings, or dollars? Now what would I really need in East Africa? What if I got hurt or sick? I'd like to have somebody have that kind of detail on my medical record. So healthcare really needs that sort of that Gutenberg moment where we really begin to learn together. And we now have an electronic record, and the learning curves are vertical and they are varied. And who's all learning? Doctors are learning how to use the electronic record. patients are learning how to connect with us. People say, well, doesn't the computer get in the way of the doctor-patient relationship? We can show you hundreds of patients who say it's enhanced it. It's really made it better because I have not only the trust of the relationship personally that I've grown to gain over time by trusting that physician, but I also get to stay connected with her over time when I don't have to go in. So actually it can be a service and a relationship enhancer once the trust is there. So we are on that learning journey. I think Kaiser Permanente is it's a hot spot to be, and I'm glad you're here today because I think we have a lot to share, but I think we have an awful lot to learn. So these are the kinds of gatherings that I think are going to change healthcare for the future and change it forever, because heaven knows the system needs to become safer and the system needs to be more efficient and certainly needs to be more affordable. So we're very fortunate that we have an administration that is very much aligned with the thinking of how do we change healthcare, how do we make it more electronically enabled, and how do we make it a better place to serve patients. So today we have Todd Park from the HHS, the Chief Technology Officer for HHS, who's going to join us, give us some words this morning, and to really kick it off. So thank you all for coming, and I'll see you at 3 o'clock.
Hello! Good morning to all of you. This is my first Kaiser Unconference. I'm so excited I can barely see straight. And I'm also sleep deprived because there's a lot going on, so that combination may not be good for clarity and coherence. So if I'm not coherent, just raise your hand and say, Todd, repeat with clarity this time, and I will definitely do that. So just a little bit of prep work here. How many of you are clinicians? Okay. How many of you are developers? How many of you are, it's okay to raise your hand more than once. How many of you are entrepreneurs? How many of you are policymakers? How many of you are in health administration and management? How many of you are in design and consumer experience work? Woohoo! Rock on, okay. How many of you actually did not raise your hand? Okay, actually, how many of you are media? Awesome, okay. How many of you now did not raise your hand? And who are you?
I'm Rachel. I just finished my PhD in neuroscience, but I'm interested in moving into this area.
Fantastic, fantastic. Who else did not raise their hand? And who are you?
Eric Peterson. I'm with Cisco, a healthcare marketing organization.
Hi, I'm Carla Gagas. I'm with Healthcare Transformation at Cisco.
Okay, awesome. And who else didn't raise their hand? I just want to make sure we got the full gamut. Hello.
Rob Harding with Telegraph Hill Partners, a venture capital firm.
Who else is in venture capital here? Okay, and who else now did not raise their hand? Wow. Let me run over this way. Sorry. Hello.
Hi, I'm Bruce Hubbard. I'm with Air Magnet.
What's Air Magnet?
Air Magnet, we make tools that analyze wireless networks for healthcare.
Awesome. All right. Who else didn't raise their hand? We'll do a couple more.
Hi, I'm Eva Kiuru from Finland. I represent Finnish healthcare technology startups. I'm a non-profit.
Wow, super cool. Woo. Rock on Finland. Okay, one more. Who hasn't raised their hand? Ah, hello. This will be interesting. Right.
Hi, I'm Susan Brown. I represent the Women's Health Conversation Network. We're putting together a network for women caregivers.
Fantastic. Well, this is really wonderful because I would submit to you that it's the mix of disciplines in this room right now. It's that mix that's actually what's going to make healthcare better and health better. And it's a mix that doesn't really happen all that often in a society that's increasingly fragmented, increasingly balkanized. So thank you so much to Kaiser and Innovation Center for pulling this together, because these are the kinds of conversations that actually can lead to the Gutenberg moment that Jack was talking about. So what I'd love to do is just A, again, welcome you to what will be a fabulous event, and then B, just talk about a particular obsession of mine, because I understand on conferences don't really have an agenda, and so I'll just sort of pick a point in space to start talking about and see where it goes. But actually the story I'm about to tell you is both an obsession of mine from a content standpoint and a process standpoint. It's about how to improve community health in the country. So what happened actually late last fall, just after I joined HHS, after a career as an entrepreneur in the private sector, was I met with Deputy Secretary Bill Cochran. He said, look, I'd really love to figure out how to leverage the power of HHS data to improve health in the country, improve community health, to help raise awareness of community health, and to help spark and inform action to improve it. Because HHS, it turns out, has just unbelievable amounts of data that it literally spends billions of dollars a year collecting from the CDC, from the FDA, from the NIH, Medicare, Medicaid, everything from smoking rates to obesity rates to hospital readmissions to cardiovascular mortality to access to healthy food, rates of mental illness, etc. And so this data actually largely sits in our vaults and isn't really used by anybody, which is kind of tragic. So Bill said, look, why don't we try to figure out a way to unleash the power of that to improve community health? Now, in a prior HHS, what HHS would have then done is published a map with all the data in it on the website, maybe, that no one would have seen, with zero impact. But this is not your mother's HHS. That's not how Greg Downing rolls. That's not how Amin Bandari rolls. So what we actually did instead was, we actually took a very different approach. We launched something called the Community Health Data Initiative. And what we did was we copied a playbook that had been perfected by an agency called NOAA. Does anyone hear what NOAA is? NOAA is the National Oceanic and Atmospheric Administration. Largely unknown to the American public until the recent Gulf mess. But NOAA, it turns out, supplies 99% plus of all weather data in America. So it's not like the Weather Channel has its own hurricane sensor network in the Atlantic. It's not like your nightly newscaster measures barometric pressure by hand herself, right? NOAA has networks of barometric pressure readers and hurricane sensors, etc., and just collects tons and tons and tons of weather data about what's going on that might impact America. Then it actually publishes that data in an easily accessible form, increasingly XML format, free of charge, to the public, downloadable, without intellectual property constraint. And then what happens is the Weather Channel, weather.com, iPhone weather app builders, nightly newscast, pick up that data and turn it into applications, products, and services that benefit the American public. A profusion of products and services that NOAA could not possibly have funded or created itself, and they take advantage of the fact that, as someone told me very wise once, no matter who you are, you have to recognize that most of the smart people in the world do not work for you, right? If you really want to have an impact, you want to figure out a way to leverage all the smart people that don't work for you to realize your goal. So we said, look, what if we actually try to do the same thing? What if we try to position HHS as the NOAA of health data, right? As opposed to sort of creating the Uber app ourselves that no one would see, to actually make our data available, like the weather data, free of charge, machine-readable, downloadable, accessible to all without intellectual property constraint, and then market the bejesus out of that data, and have other people, much faster, much more creative than us, right, collectively, turn that into awesomeness, right? Turn it into applications and products and service insights that actually help inform the country about how to improve health. So we actually pulled together a meeting March 11th, much like this one, a little smaller, about 45 folks, who were public sector and private sector innovators, to actually brainstorm about this idea. And they were a mix of two kinds of rock star. Again, in the spirit of mixing, right? One class of rock star were people like Linda Bilheimer, or Don Berwick, or Ed Sonic, people who are just super deep healthcare experts, like Mick Jaggers of the healthcare world, right? They've forgotten more about healthcare in the last 5 minutes than I'll ever learn, right? Then the other class of rock star were people like Anil Dash and Tim O'Reilly, people who had never been to a public health meeting in their lives, right? But are geniuses at how you take data and shape people's lives. And very tellingly, Tim O'Reilly had never met Don Berwick. Didn't even know who he was, or vice versa, right? But they came together and then magic happened. Because what we first did was we said, look, does this idea of HHS as the NOAA of health data make sense, or is it just like the dumbest idea ever? And they said, no, actually it makes a lot of sense. So then we said, okay, if it makes sense, here's a bunch of data that HHS could publish, or already has published, right? What kinds of applications could you put together with this that would benefit people right now? And over the course of the next 6 hours on March 11th, they brainstormed about 20 different classes of applications. Community health maps, online games, analytical apps, decision support, etc. 20 different classes of applications that actually could benefit people right now, using data that HHS had right now. So then in the fit of kind of unconference impromptu improvisation, I, without totally checking with the secretary, said, I'll check with the secretary, but on June 2nd, the secretary, Bill Kaur, Harvey Feinberg, president of the Institute of Medicine, Anish Chopra, CTO of America, me and the HHS team, will host a public meeting. And whoever one of them is can build one of the apps you just invented, right? We'll showcase you in a huge public meeting, webcast to make you famous, and celebrate what you've done. And we had kind of a private school auction where we had the different ideas on the wall and said, who's gonna do that one? And people actually raised their hand, formed teams to start working on these, recruit other people. A week after actually this March 11th meeting, we published a bunch of this data in a form that was really easy to find and really accessible. And then 82 days later, on June 2nd, one of the most amazing displays of American innovation I've ever seen transpired. If you actually have a spare couple hours at some point, go to YouTube and search for Community Health Data Initiative, and you'll see the 2-hour session where 7 of the coolest apps that people actually put together that were either brand new or improved using our data were demoed by the teams. They were astounding. Absolutely astounding. And they were part of over 20 plus apps that were showcased that day. And just to give a couple of examples, right, just because they're brilliant, right? So we've got this data set called Hospital Compare. People know about this data set, Hospital Compare. It's one of the coolest data sets in the world, right? It's this data set that Medicare compiles. It actually has hospital by hospital quality and patient satisfaction ratings. Really awesome, right? The way you really access this today is you go to an HHS website and you search for your hospital and try to compare it, right? Not a lot of people know about this website. Even fewer people think it's usable. And basically, the value of the data is, I think, not fully realized. So Microsoft Bing had this very simple and brilliant idea. They said, look, take the now downloadable hospital compare data set and integrate it into search. So if you type New York Presbyterian Hospital, for example, into Bing, it pulls up the patient satisfaction rating with the hospital compared to state average, right? So basically, instead of actually making people realize there's a website and making them go find the data, bring the data for people already looking for something that the data could help. They probably just 50x the social return of our investment in Compare, right? Another fantastic example, there's actually a fantastic partnership that's formed over the last few years between the National Association of Counties, a startup called Trilogy, and the University of Berkeley, a great collaboration of academia, entrepreneurship, and government. And they put together this thing called Network of Care for Healthy Communities, which is basically a community health dashboard that shows in layperson terms how your county does, or community does, versus key national metrics in a way that anyone can understand. And even more awesomely, it connects you to an inventory maintained by Berkeley of successful interventions that other communities have executed to move the needle positively on something you care about, like smoking. And it links you to an inventory continually updated of state and federal legislation that you might care about that would impact the indicator. It allows communities to basically share knowledge with each other about what they're doing that could be impactful. Because actually, as we all know, you don't transform healthcare in America, right? You transform health in America one community at a time. And there's so much experimentation, so much energy happening at the local level that isn't really widely known. That if we could just tap into what's going on locally and have people share knowledge with each other about what's working, that would in and of itself be a revolution. And another example, I'll just give one more, is actually a startup in Boston created this game called Community Clash. And it's going to sound really silly to you, but it's actually really awesome and interesting. It makes a really good point. It's healthcare poker. So basically, you pick a city like Boston, right? And you pick an opposing city like New York. And you dealt 5 cards each of which corresponds to a health indicator, like smoking, obesity, access to healthy food. You actually, while the cards are face down, get to substitute 2 of the cards for 2 indicators that you think Boston beats New York on, and then you show your cards, right? Now, it sounds a little silly, but I'll tell you what, of the 20 plus applications that were demoed at this event on June 2nd, everyone could go and check them out afterwards in the big kind of town hall kind of structure. The longest line by far was for this game. I played it for 3 hours straight with my wife, no kidding, that night, right? And I've been in healthcare for almost 20 years. I learned things about American health that were very fundamental that I didn't know. I learned that rates of mental illness in America are much higher than I would have expected. I kept trying to find a city where the rate wasn't high and I couldn't find one. And that will impact how I act and what I decide to do going forward in ways that I can't even begin to imagine. How many of you actually play Farmville? It's okay to admit that you do. Okay, so this crowd knows what Farmville is, right? It's this online social network game in Facebook where you basically run a farm and trade sheep with each other, right? So does anyone here know, after about, what, a year and a half of development, how many active monthly users Farmville has? 73 million. Wow, right? I would submit to you that if you're talking about improving awareness of health and community health in America, it is far more likely to happen with a health version of Farmville than by making Americans go listen to public health lectures on a website, right? So I think that the guy or gal who designs HealthVille, or its equivalent, will be one of the most important figures in this future moment, right? And that's something that actually excites me tremendously. And so, and the meta point of all this is that the government didn't do crap, right? The government just basically said, I got a bunch of data, and marketed it to the right people, and they turned it into magic, right? They really did illustrate the principle that most of the smart people in the world don't work for you, and they don't work for the government. But if you harness their energy, right, you can do amazing things. So we're in the process now of basically taking the whole community health data initiative to the next level. So we're publishing even more data, which I can go into a lot more detail. We're actually mobilizing the ecosystem at a whole new level, and actually increasingly, the ecosystem is being mobilized not by us. So two of the most pivotal figures in this whole initiative are the great Matthew Holt and Indu Subaya, and they had this brilliant idea, which they launched on June 2nd, which was the Health 2.0 Developer Challenge, which you can check out at health2challenge.org. And it's a beautiful, simple idea. It's a site where basically anyone can challenge the world to build the best app that does X. HHS actually has issued a challenge around the best app that takes our hospital and nursing home quality data and turns it into an app that's actually useful for consumers. Yville has issued a challenge for the best app that engages kids in health data. Robert Wood Johnson Foundation has issued a challenge for the best app that makes their county health rankings actionable. It goes on and on and on. And it's amazing. There's like 12 challenges on there now. We're going to announce the first winners at Health 2.0 later this week. And it's going to be an evergreen Health 2 Challenge Forever site, right? Which is fantastic, right? And there's a lot of other stuff going on as well. Increasingly not choreographed, even actually sort of something the government's even aware of, which is exactly where we want it to be. We want the ecosystem to become this mushroom cloud of joy and mojo and public benefit. The government is just another player, right? That's enabled by the soil of our data, right? By the way, actually, private organizations are now starting to contribute data as well to this field. But with all the action, the thousand flowers blooming, being really totally out of control, right? Because that's the moment where beautiful things happen, is where there isn't a central intelligence, where there's a collective mojo flowing in millions of different ways to do incredibly cool things. 1 out of 10 of which, 1 out of 100 of which even, could lead to a good moment and truly be revolutionary. So I say that for two reasons. I talk about this for two reasons. One, this is a particular obsession of mine, open health data, the community health data initiative, mobilize the ecosystem. Two, I think that the whole process of how we've pursued it is how the government really wants to roll going forward, right? We see the government as a catalyst, as a member of a larger community, but not really as the driver, not really as a central actor, right? We see y'all as the collective central actors, and we want to do everything we can to help you rock the house, right, and save the world. So what I'd like to do in my session is basically, do a set of additional brainstormings around open health data and community health data initiative. Tell us what next steps we should take, or that we can help facilitate, that would actually help advance the ball on the world leveraging health data to change the world. I'll leave that open-ended, and my goal is to walk away with 3 things that I'll commit that we'll do as a government in some small way to be helpful in helping the world leverage the power of health data to change the world. So I guess just to conclude my unstructured remarks for this unstructured conference, I'm incredibly thrilled to be here today. I'm so excited to be here in the same room with all of you. I can't wait to see what happens. And I hope that today makes history. And I have every expectation, knock on wood, that it will, thanks to you. Rock on.
All right, here you go, Matthew. Thanks, Todd. That should actually be the great Todd Park, actually the great Indu Subaya, but not the great Matthew. Come on.
The great Matthew.
No, I don't think so. Hi, I'm Matthew Holt. I am the co-founder of Health 2.0, the conference. I'd like to say 2 quick things before I hand over to Indu, who's going to tell you a bit more about the challenge. First thing is that, I'm going to make sure that I'm facing a great Ustream of this, so I'm looking good. First thing is, this is one of about 23 events in Health Innovation Week. We have, with our colleague Peter Grant at Healthcare Conference Administrators, he was talking to us and we said, let's set up, make San Francisco, sorry Oakland, make San Francisco the center of healthcare for this week. And we have, I think, more than 20 events, including, of course, HealthCamp, SFA, which I think is one of the few events outside of San Francisco itself. We actually kicked this off and got a proclamation from the mayor, and you can see that on the HealthCamp blog. I just tweeted the link to that. A bunch of companies, a bunch of startups in San Francisco and a small Oakland company called Permanente met on the steps of City Hall and proclaimed this to be Health Innovation Week in San Francisco. And we're so happy and proud that so many people are here to see that. So give yourselves all a pat on the back. Of course, me, I'm mostly concerned about this little Health 2.0 conference tomorrow. About 1,000 people are going to be showing up to see all kinds of amazing innovations, and there's all kinds of stuff going on. Worth mentioning about the Health 2.0 organization that we do have a non-profit, the Health 2.0 Accelerator. Julie Murchison, I see snuck in the back there, who is actually the recent ex-director of the Accelerator. She's now moved on. But the Accelerator is going to be doing something very, very interesting, and members of the Accelerator are here. On Friday morning, they're going to be unveiling, in the spirit of this, an apps network, the Accelerator Apps Network. You'll hear a lot more about that, but you've seen there's been, I think, 7 or 8 companies working really, really hard together to sort of build composite applications in a really innovative way, working with big players like Microsoft and Shared Health Plans and some other providers. But that's a really exciting piece, just one of the many things that will be on the Health 2.0, but it's the kind of innovation that we're looking to see across healthcare. And we'll be showing you some examples tomorrow at Health 2.0 about how that reflects, how that's reflecting in healthcare, all the kind of innovation we've seen outside of healthcare from, as witnessed by folks like Tim O'Reilly and others that Todd mentioned. So with that, I'm going to hand over to Indu, and she's going to tell you about the Health 2.0 Developer Challenge a little bit more.
Just wanted to just make a few remarks. Todd mentioned quite a bit already, but the Health 2.0 Developer Challenge is active and ongoing. I'm looking for your participation. 12 companies joined us to issue challenges, and over 80 teams from around the world submitted and played along. 6 will have winners announced on Thursday by Anish Chopra, Todd Park, and Peter Levin. And we also, the Developer Challenge has also a live component with codathons and hackathons, which are events where people get into a room and actually build applications on the spot. We sponsored and co-hosted the first one with our friends at HealthCamp about a month ago, and Ron's going to talk more about that. And then we ran another one at Google, just kicking off Health Innovation Week. Over 300 people came to both events. I actually see one of the teams over here that's going to advance to a special developers arena at Health 2.0 and have a chance to win $2,500 and present to senior members of HHS and the VCs. And the online challenge, I see a winner here. He's hiding somewhere, but that team walked away with $10,000 from West Wireless for building an incredible application. So anybody can come talk to us, health2challenge.org. It's free to throw out a challenge if you're a nonprofit, academic institution, foundation. And we'll also be hosting a number of codathons in the coming year. If you have space and can feed 100 people, come talk to us. We'd love to co-host one with you.
Thank you, Indu. And I'm Ron Whitman. I'm the founder of HealthCamp, and I'm really happy to be here to announce that we are looking for the first 100,000 developers that will build applications around health and well-being. And imagine a world that started just a few months ago with this amazing initiative of the government that will have 100,000 health developers that will create health applications. A lot of you here are developers or designers or healthcare practitioners that can build these applications. And we will have 100,000 of you working together on the data, starting with the data that the government released, but other companies are releasing data. Indu and Matthew brought on other companies that brought other data like First Data Bank, like
Gallup and Healthways releasing data, but more in the pipeline.
More in the pipeline. Companies releasing data, the government is releasing data. Bring your creativity, right? The Mayo Clinic has a lot of creative people. Other people in Kaiser Permanente, in Cisco, but a lot of small developers, right? With great ideas. What we want to do is bring you together, like we did at HealthCamp 3 weeks ago. We thought we were going to have 30, 40 developers coming in a room to hack away. Hunter is one of them, actually. We actually had 200 developers. We had to close the doors because we couldn't accommodate more in the office of a startup. People were hacking away in the corridors on the floor, and we have pictures on our website on healthcamp.com if you want to see what happened there. It's quite amazing. So now we have about 350 developers in the network already just after a month, and we want to get to 100,000 developers. So help us with that. Help us with your ideas. Start here brainstorming, forming teams, and come together with ideas that will really transform health. We're really excited to do it, and thank you very much for your time.
Welcome to HealthCamp. So my name is Lauren Connery. I'm one of the organizers here at HealthCamp. Mike Kirkwood and I are representatives for the San Francisco Bay chapter of HealthCamp, and we have Mark Scripshire here who represents the national chapter of HealthCamp. HealthCamp is entirely volunteer run and organized, so we don't get paid for this. We do this because we really care about really adding innovation and more exciting different ideas into the healthcare system. I just want to take a moment to say thank you very much to our fantastic sponsors today. We have Kaiser Permanente, obviously, that has donated the space for us today. We also have Cisco and Sprint, who are our two key sponsors. We have a fantastic lunch, and we'll have beer and wine later on for you too to help the networking process. So I know that everybody's very excited about that. We also have a lot of smaller companies represented, and we have a whole list of them. We had 21 different volunteers to add sponsorship to HealthCamp here, which also helps support the efforts. So I really want to say thank you. We appreciate your support. And thank you for coming.
Okay, so hi, Mark Scrimshire. We started HealthCamp, or reinvigorated it 2.5 years ago. There's been about 25 health camps around the world. A couple of thousand people have attended. And really, I think Todd nailed it. It's this chance where developers and just people that are passionate from all sorts of walks of life can come and talk and generate ideas around making better healthcare. So that's really the purpose for today. You've really got to leap in with both feet, and let Mike talk a little bit about the rules of unconferences.
I think you might have a t-shirt this year. I managed to sneak a HealthCamp t-shirt.
Fantastic. So now we're going to move towards the mushroom cloud part of the day. And there's 3 quick rules that I wanted to talk about related to the rules of engagement for HealthCamp. First rule is that it is all about you. And what we're asking for you to do in a few minutes is to bring your idea that you want discussed today, or you want somebody else to discuss today, and invite them into a conversation. I want to talk to you, or all of you, about this thing that I think might be a pivotal part of the solution, or a part of the solution. The second thing is that it's also all about them. And so there's a concept we call the law of 2 feet, which is really simply, you are not captive at HealthCamp. If none of the 15 sessions are interesting to you, create a new one. Find a common space. Bring one person into a space that you're comfortable with. Always take the courteous exit at the same time, but we assume as facilitators of sessions that it's okay for people to want to see multiple things in 1 hour. And the final thing is that the only thing that could happen will happen. And so it is about the magic, the moment today, and experiencing the idea of your idea exchange with somebody else. So with no further ado, we're going to jump into the process of eliciting ideas to go on the board.
Okay, so what we'd like you to do is grab a card. If you're interested in...
Can't hear you.
Use the mic.
So what Mark's going to...
Okay, what we'd like you to do is, if you're interested in getting a session going, is grab one of these cards, grab a pen, mark down what's the title of your talk, put your name against it or your Twitter handle so we know who's involved, and we can then go and paste this onto the wall. We've got about 120 slots going. So 4 sessions through the day, 15 rooms, so feel free to get a session going. I know Todd was interested in a session, so let's have some quick, we're not going to go through everyone, but let's actually get some of these announced. So let's pick, who's got a card actually prepared? Hands up, anyone?
So first session in area number 2 that will be devoted to the Health 2.0 Development Challenge will be about hacking for health. If you're interested in development of application apps around health, room number 2, that will be dedicated the entire day for the Developer Challenge.
Okay, let's keep the intros short and quick. We don't have a lot of time.
How can we change healthcare delivery with real-time health analytics, APIs? What can we build? What can we change?
Okay. And feel free to go over and actually put your session, grab a slot on the wall.
Hi, I'm Dave. I need the help of everybody in this room. My session's going to be right here. Danielle, is that okay? And I need the help of all the people in this room to come up with the team members, the people, the voices who need to be present to come up with the ideas that all these challenges are going to actually reify. They're actually going to bring to life. So I want to know, if you think an architect needs to be involved in a national healthcare discussion about how the country can be well, tell me. Or if it's somebody else, tell me, whoever it is. Thank you.
Excellent. Any other volunteers? Come on.
I'm going to do a session on the quantified self. What personal data do you track, share and learn, show and tell?
That sounds interesting.
Mark, here's one over here. Hey, Nick, did you say?
UI, UX, and interaction design and enterprise health technology.
Excellent.
Good morning, everyone. I'm Jeff Panavi. I'm a dermatologist from Kaiser in San Diego. I'd like to talk about an online patient bill of rights. It's a conversation that I'd like to continue that we started in San Diego after the idea that you can check in at a syphilis clinic on Gowalla or Foursquare, which a lot of physicians think is the most ridiculous thing they've ever heard of, but patients do. So I think it's something that we need to talk about is what is privacy and health online?
Hey, I just want to point one thing out. So on the back of your map, there's room capacities for each one of the rooms. So we have 15 rooms, and then in blue is the capacity for each one of the rooms. Some of the rooms have projectors in them, a lot of them don't, so just be prepared to have a fantastic conversation.
All right, I'm just Paul from the Gobi Group, and I want everybody's help in redesigning a safety net hospital in one of the poorest sections of Cape Town, South Africa. It's a real problem. They've got real money. They've got $2.5 million rand to do this, and they've asked for our help. And I just want to get bright minds together to help us come up with some good solutions for them.
Hi, I'm Kathy English with Cisco, and I'm a nurse. And I would like to talk to you about the value that we can bring to nursing in helping to reduce some of the communication challenges we have in receiving access to data, to information, to people, perhaps video, telephony can all help. So I have some ideas I want to discuss with you.
I'm Susan Brown from the Women's Health Conversation Network. Social media would like to talk about building social networking for women caregivers.
One quick comment here. Obviously, there's a lot of people, a lot of different ideas. Don't be afraid if you go and see something on the wall that you think that's similar to what I want to talk about. Maybe you want to merge sessions. Okay?
Hi, I'm Chai Hu, and I would like to have a conversation about mobile health and social. Of course it does. If you have any questions about the technology or anything else, love to talk to you.
Hi, I'm Tim Fisher from Smart Design, and we're going to be leading a discussion on how great design can lead to better behaviors, patient outcomes, and compliance.
Hi, my name is Sunny Southern, and I'd like to build an online interactive game that helps kids understand the decisions that they make and the ramifications of those decisions to fight childhood obesity.
Excellent.
Hello, I'm Dave Snyder from 42 Tech. I'd like to get together with people for a session on medical device connectivity and the convergence of clinical engineering and IT networks. This may go together with some other sessions, or it may stand alone. Medical device connectivity.
Hi, I'm Lorenz Sell. I'd like to have a conversation about how social technology can be used to motivate health and fitness.
Hi, I'm Laura Kusamoto, an independent producer, and I'm interested in Web 3.0 and how we can use the power of 3D graphics for immersive education and collaboration in healthcare.
Hi, I'm Alex Fair from Fair Care MD. I'd like to talk about top-down versus local-up How are and will grassroots movements change healthcare?
Hi, I'm Mark Resch, and I want to talk about high bandwidth remote access from mobile devices, having sensors in homes, and the systems to make that things like FaceTime more possible remotely.
Hi, I'm Philip Marshall with Press Skinny, and I'd love to lead a session on patient voice, gathering and using patient feedback all the way from their expectations of care all the way through the outcomes of care.
Wow, ours are complimentary. Maybe we should combine sessions. I'm Anne-Marie Biernacki. I'm with HealthCamp Corp and the Know My Meds product, and I want a conversation about patient self-reported data integrated into care delivery. How do we interoperate with the EHR and the EHR?
I'm Matthew Browning with YourNurseIsOn.com. I'm interested in leading a session on healthcare workforce trends, projections, and utilization.
Hi, I'm Kendra Schimmel from Adaptive Path, and I'm interested in talking about how healthcare is procedure-centric and patients are not, and how we can improve patient engagement for better health outcomes.
Hi, I'm Bobby Hughes from Kaiser Permanente Innovation Consultancy. I want to talk about encouraging and supporting innovation and ideation from frontline staff.
I'm Alex Banks, and with Intellis, I'd like to have a session on technology applications to encourage behavior change,